So in the last minutes here, I'm just going to briefly talk about cervical cancer. And the discussion in cervical cancer really has been on prevention and vaccines over the past several years. As you can see, cervical cancer is still quite prevalent in developing countries. And so I found this trial interesting in that it tried to improve our first-line treatment in patients with newly diagnosed cervical cancer. And since 1999, we've basically been using a cisplatin weekly schedule with pelvic radiation. This really hasn't changed since 1999. And what this study tried to do was to see if adding a secondary cytotoxic agent improved survival. And the agent that they used was gemcitabine, which has strong radiosensitivity. And what they did, which we'll talk about a little bit later, was include the gemcitabine not only in the concurrent chemotherapy radiation, but in addition to that, after about a month of rest after treatment, provided 2 additional cycles of cisplatin and gemcitabine. And this is the standard arm with no adjuvant chemotherapy. So there was a lot of data here, but I just basically brought you to the overall survival curves because you don't see this too often and such a large difference in overall survival with a hazard ratio of 0.68. The toxicity was definitely higher in the gemcitabine arm with more diarrhea, nausea, vomiting, and cytopenias. And I think that it's very intriguing to see how large of a difference survival was shown in this combination regimen. The improvements were mostly seen in the distant in reduction of distant metastasis with no really change in local control. The toxicities were higher, and I think what this is going to lead to is further trials in this combination and trying to tease out, is it the addition of gemcitabine with the radiation, or is it just giving additional adjuvant therapy after the concurrent chemoradiation is what made the difference.